Hi, this is Rob Fitzgerald. Welcome back to another quick hit in lab medicine. We're going to be talking about the definition of acute myocardial infarction. So our objective is to describe the universal definition of an acute myocardial infarction, and this has evolved over years, and we are currently in the fourth universal definition of myocardial infarction, and the reference below is a group of experts that have convened, and as I said, this is the fourth version. They have about 19 pages to define what an MI is. We're going to do it in about 10 slides, so we're going to sort of try to hit the important points. What is a definition of an MI? Definition of an MI is myocardial necrosis, so that's cardiac cells that are dying in a clinical setting consistent with acute myocardial ischemia. So typically that's associated with chest pain. So the actual definition really is almost defined by laboratory values. It starts with a rise and or fall of a cardiac biomarker, and we'll have a separate topic on the cardiac biomarkers. Preferably we're talking about troponins, and most likely we're talking about highly sensitive troponins, with at least one value above the 99th percentile, and some clinical symptomology. So symptoms of ischemia, that would be chest pain. EKG changes in the ST or bundle branch blocks. Pathological Q waves, so those are another EKG finding that would be particularly bad. Imaging studies showing loss of contractile muscle. Identifying a thrombus by angiography or at autopsy, or you could have a cardiac death before biomarkers were available or were increased. So the diagnosis actually gets a little bit more specific and talks about how you diagnose an MI after cardiac interventions, such as a PCI or percutaneous coronary intervention, such as a balloon angioplasty or a stent placement. And so in the case of PCI, the definition changes a little bit because you are, by definition, destroying some cells in the process of doing a cardiac intervention. And so the criteria, instead of being greater than the 99th percentile, is 5 times the 99th percentile. A coronary artery bypass graft involves transplanting vessels into the myocardium, and consequently is a bit more invasive. And so instead of being 5 times the upper reference limit, it's 10 times the upper reference limit. Diagnosing previous MIs, they also spend a little bit of time talking about, and basically pathological Q waves with or without symptoms in the absence of non-ischemic causes. So those would be EKG changes, imaging evidence, so similar to what we talked about before, where you have decreased myocardial contractility, or pathological findings of a prior MI. So that would be at autopsy. We classify MIs as type 1 through type 5s, and it's difficult to differentiate these classifications, at least type 1s and type 2s, but it is important because it does have a difference in how patients get treated. So type 1 is what most people typically think about when you have a coronary thrombus, a plaque rupture that blocks a vessel, and so that your tissues downstream don't get oxygen and cells begin to die. So that would be a type 1 MI. A type 2 MI is a myocardial infarction due to relative demand and supply of oxygen. So in the setting of coronary spasm or exercise, could cause a type 2. Myocardial infarction resulting in death when biomarkers are unavailable would be a type 3. Type 4s and type 5s relate to surgical intervention or coronary invasive procedures. So a type 4A, that would be when we have greater than 5 times the upper reference limit following a PCI. 4B would be when you put a stent in, and that is typically a metal stent that's keeping the coronary artery open for blood flow. And type 5 MI would be after a coronary artery bypass graft. And really, I think about type 4s and type 5s as post-surgical, and you can use that to see how good your surgical techniques are. Classifying MIs, another picture, sort of a graphic picture, a type 1 where we have a thrombus that's clogging up the artery and it ruptures and occludes the artery, and downstream cells begin to die. They start to release intracellular contents, what many people term biomarkers, such as the troponins. A type 2, several different kinds of type 2, a vasospasm where you get a constriction, where you have a fixed supply would be a type 2. So you have atherosclerosis that's clogging up the arteries, so you don't get good blood flow through there. And then finally the supply and demand, where you have an imbalance and not enough supply to meet the demand of the myocardium. So that's a quick definition overview of defining an MI and classification. Thanks for your attention.